Well, good afternoon, Dr. Coffman.
Hey, good afternoon, Allison. How you doing?
I'm doing great. How are you doing today?
I am perfect. It's good to see you.
It's great to see you. It was not so great to wake up to some news today that is showing that our COVID numbers in Hamilton County are yet again at a peak. I'm assuming you did see that report, and I would love to know, not to start on a low note, right? But let's start on a candid note, right? Like what was your take on those numbers, and should be our takeaway when we see that data?
Yeah, I think the just to say, hey, keep paying attention to this. So we are up to 637 active cases, which extrapolates to about 7 to 18% of the population is active coronavirus right now in Hamilton County, which is about 1 in 5 to 1 in 14. So that's a lot of people. And the other sad thing is our death rate's been climbing. And this week, a 40-year-old who did not have any previous health problems passed away. So I think having clarity in that this is still here, and that it's very important. And as we always talk, you got to live your best life, but
Yeah.
you've got to know what's going on around you and be aware of the challenges.
And I know we talked about it on Sunday, but the disparities that exist, right, under, well, let's say normal circumstances, which for many people, the normal is still not my normal or your normal. And we've recognized that, especially in the communities of color, right, in the Latinx and African American communities, that they are disproportionately affected. So I had a great talk with a dear friend of mine this week who is African American, and we were just talking about COVID and affecting our communities. And she is just a champion and a change maker. And I was, reflecting on the fact that I know a few people who have gotten coronavirus and then have semi-quickly over a 2-week period recovered. She has known 43 people who have died of the COVID virus. 43 people. And she said under normal circumstances, if she was mobile and not having to quarantine, she would have gone to at least 26 or 27 of those funerals. That's how close they were. Mm-hmm. And that, to me, right, like, we can read stuff in the paper and we can, watch articles, podcasts, listen to this, right, dialogue. But that was such a startling reminder of how different just each of our narratives and realities are around this virus. And that it's not about me, right? It's really not. Like, I want to always safeguard my family and my neighbors and my extended family, et cetera. But I need to safeguard the people who can't safeguard themselves.
Right.
And how do we do that, right? I know, look, we never take for granted. You can see my little smiley face in the back, still wearing her mask, right? The mask is important, if only because it shows each other that, we respect each other, right? I care about you. I don't even know you, but I care that I don't infect you. What are other ways that we can sort of help not just address those disparities, but further care for those communities that are just seeing this outbreak in numbers so much greater than others?
Yeah, it's been interesting to watch my daughter's social media, and then they've shared. They have a bunch of group chats. I don't know how your sons do,
Yeah.
but that's kind of how they're hanging out now. And it's been fascinating to watch the conversations that 17, 18, 19, 20-year-olds are having. And I think, a lot of white fragility. When you're trying to talk about this, a lot of folks immediately go to, you're yelling at me or you're blaming me, and where it's simply a conversation of, this is something you may not appreciate, and so opening up and just being patient with that. And I think we keep coming back to it, is it's so important to be graceful in this time. I think it's interesting on social media when you see, especially white people, trying to support the communities of color, and now there's kind of this, here's how you do it, and don't do this, and then it degrades into people judging each other. And it's like, really, we're going to be hypercritical of each other when we're trying to figure out how to be graceful in this situation. And I think it's been so interesting to watch people move to the ends of things, where some people want to crawl in a cave and cinder block the door, and then you've got people who want to pretend like nothing's going on. And you and I have talked about, uh, so many people have talked to us offline about enjoying this conversation because they feel like this is real. Like, it's not like, I hear people who want to just, lock themselves up. And I realize, like, I can't do that. I'm tired of doing that. I'm not going to survive if I do that. And then I have people in my life who want to just act like nothing's going on. And I know that's not right. And it scares me, and I worry about it. And so I think being, one, letting people know, like, this is where I'm at. Like, I want to be a good community member. It's so different from what we're used to. Self reliance is so important, and what I have, and it's been interesting to watch people that were so important 3 or 4 months ago in our culture, athletes and musicians, and we, and image, what influencers,
Yeah.
and immediately they became useless. And what became very important were the people that were stocking the shelves at the grocery store, our UPS and FedEx drivers, teachers who were on the fly having to figure out how to teach online, and nurses that were just taking care of people that didn't have family around in their sickest time in their life. And so I think it's encouraging to me to see, uh, young adults paying attention to that. It's not been lost on them that, baseball superstars and football superstars have not been that important the last couple months. And so I think, looking around and starting small, and we've said, the most important step is taking care of yourself. And so being aware of where you're struggling right now, being vulnerable in that, sharing it with other people. When people are taking your energy, being very polite and gracious and drawing boundaries with that, looking around and seeing, in my community, who doesn't have food right now because, they can't get out, or, they're afraid to use public transportation, or the people that they usually rely on, like at church, that's not happening right now. So being aware of that and just starting small, and
Yeah.
kind of asking around. I think we talked a little bit last time of, looking at small businesses that are owned by people of color, and being purposeful about supporting them, encouraging them, telling them that you just appreciate having them in your community. It's important to you that this business and these people are a part of our community in Chattanooga, and they hear it coming from somebody that looks like me, that doesn't normally take the time to do that. I think, people who are struggling with housing right now. We had a big bloom within the Hispanic community in our community, just because, a lot of them have multi generational households. They some of them live in smaller square footage, where if someone gets sick, you can't isolate them. They're
Right.
still right there with everyone. And so a lot of people need help with that. And I think the city mayor's office has been very responsive in trying to make those resources available. And then just think about people in your life that are vulnerable. So I think, we've had two friends that, have had gotten bad news recently, in regards to cancer diagnosis. They were they were kind of putting it off. They knew something was going on, and they were afraid to go to the hospital. We're seeing an uptick in cardiac complications here locally.
Mm.
And I think, being aware of folks that who are socially isolated, whether it's, that's just who they are, or, they're single moms who are working and taking care of kids, single dads who are doing the same thing, people who are recently divorced, people who have been recently widowed, or widowers. Those are folks that are very vulnerable. And then I just think the people in our lives who emotionally have to be in control. And those, I think it's been very hard. And I think a lot of what we're seeing right now from a society standpoint is that as Americans, we are used to living in the illusion that we have control over everything. And I think you see that with all the conspiracy talk, because it's very hard when, to think that, like, our planet has these viruses that will just pop up and kill a million of us. That's really overwhelming for modern people,
Hmm.
who are in control of everything. And we would really like that it's some bad guy in China, his fault. And if we can just get him, then this will all go away. And so conspiracies are really, really helpful, in regards to us managing, our challenges as first world people wanting to be in charge of everything. And I think seeing them for what they are, they're not helpful as we try to grow and be a better community through all this.
Yeah, someone will tell me on a lighter note that if this had happened, like, to the Jews leaving Egypt, and they had been quarantined for a month, then today we would have been celebrating some 4-week holiday called Koronica or
Yeah.
something. So, you know,
And it would have really good food.
you're right, right. But yeah, we hope. No fasting, no fasting. So I want to remind people as they're watching, right, and if you're watching live, that we love when you ask questions that Dr. Coffman can answer spontaneously, because I know your question are questions that so many people will likely or do have. I also want to note, I know we have people who watch outside of the greater Chattanooga area, but when you talked about not being alone and people in need, that I know the Community Foundation of Greater Chattanooga and United Way are two entities, and they have many partner foundations who are working with them to provide relief and grant funding for those in need. So you are not alone. If you are someone, if you know someone who needs anything from rent relief or subsidies because they've been affected by COVID-19 with their job and their income, if you know somebody who is struggling, from a social service standpoint, there are so many outlets and opportunities for connection. So those are just two in our city, besides the city and county themselves, who are working to make sure that nobody feels like they're left on this island, right? And we're very grateful for that. So I wanted a practical question, right? Let's say, my kids are luckily, we've been healthy, knock on wood, right? We've been quarantined. We're doing all those things. Let's say my kid comes home, or my kid at the end of the day has a fever, right? Can walk me through protocol, like as a parent, as a neurotic Jewish mother specifically, right? What should I do? I want to be prepared, right? I frankly don't even know. I know I can look it up, but where should I go get a test? Who's going to give me back the most rapid test? Does my pediatrician have access to that, or does my pediatrician need to recommend me to that site? And in the meantime, right, even if it ends up hopefully just being, the flu or just another type of virus, do I quarantine my whole family before or until I get those results? Because I just feel like the more these cases are rising, the more these questions are going to come up for people who just haven't had to deal with the virus until this point.
Yeah, so it's a little bit easier right now because the other illnesses in the community are fairly low. Although we are still seeing, I'm still seeing strep throat in the office. I'm still seeing some other viral things. It's amazing that in families that are heavily quarantined, that viruses and strep can still
Right.
sneak into their lives. But I think and I think you're hitting on what is really going to be the most important thing for the next, few months and year and a half, 2 years, whatever this ends up being, and is that when someone in your family is sick, the entire family needs to isolate. And so there's a lot going on right now where families will get a call that the next door neighbor that we played with this weekend, that the dad, tested positive, or granddad tested positive, and he was there. And so if you've been in contact with someone who has tested positive, and like we've talked about, spending time indoors for extended periods of time. So, one of your son's friends test positive and they played Xbox for 2 hours right next to each other. What I would do is then isolate him. And if you guys are in close contact with him, you guys need to isolate as well. And so typically we're seeing symptoms show up within 5 to 7 days.
Okay.
And then once you have symptoms, you need to be tested. And so if you're starting to see bad fatigue, bad headache, sore throat, GI distress, especially diarrhea, and then if you're seeing cough, shortness of breath, those are things that, and then fever, you would need to be tested. Um, we have a couple different outlets for testing here locally. Hamilton County is doing a lot of testing. And so calling the health department and setting up an appointment with them is one option. And then a lot of the local physicians have networks where we've come together and developed testing. And so I would just call your doctor's office. We are seeing a lot of folks in the office that are not coughing, but are tired or have a sore throat. And because if they're not coughing, it's much easier to kind of control the risk of spread. Most doctors' offices have closed their waiting rooms, and so you're just coming straight into a room, and then we're sanitizing between each patient. But I wouldn't, like, if the next door neighbor tests positive and your kids have been playing in the backyard, I would not run out and get everybody tested if you don't have symptoms, because the testing is not benign. It is uncomfortable, and especially your 4 or 5 year old may not come near you for a couple weeks if you take them to get tested and they think it's your fault. And so, and what happens is that you get tested, and then it's negative, and then 3 weeks or 3 days from now you run symptoms again. You got to go get tested again, and so I would wait until you have symptoms, and that's what's going to be as we go through. Trying to control the spread of this, that being aware of who's sick in your household, everybody's shutting it down. Workplaces and schools getting much more generous with sick days, and allowing and supporting people, in working from home and doing schoolwork from home. That's going to get a lot more important this year as you go along. And then I think, if you had a mask on and you were social distancing, and you just talked to them at the grocery store for 10 minutes across the aisle when you saw them, and then they test positive, that's a really low risk engagement. It really has to do with being in close contact for extended periods of time and being indoors. And what we're going to see pop up as people start doing more, it'll be, I ate dinner with them at a restaurant. We sat next to each other at a religious service. We were at a funeral together. With some of the, I'm amazed. I've had a couple where we were at the socially distant graduation, but we were all standing in a big group waiting to march in and be 6 feet apart. That's come up as well. But I think it really is going to be about watching your symptoms and then being careful around those events.
Okay. Yeah, and we have two great questions. Thank you all who are listening and actually submitting your questions. So I'm going to piggyback these because they're semi-related. So Jill wanted to know what advice you can give around expanding our isolation circles, right, to include grandparents specifically, which we have talked about before, being a particularly vulnerable community. And I think we're all working on that generational spectrum of trying to protect above and below us. And what are those factors that we should consider as we expand it to that older generation? And then Charlotte wanted to add also, and I love this question because I have that same question, and maybe I take it for granted, but that if we're meeting in a small group, but outside and social distance, do we still need to wear masks?
It's one more layer,
Okay.
So I think, that as far as what we're talking about is decreasing risk. And so being inside, being in large groups, being in mixed groups that, where you've got people coming from different places or different households, all that's higher risk. You can decrease that risk by being socially distant. You can decrease that risk by using really good hygiene, and especially not doing things that are difficult to maintain hygiene, like eating in close proximity to others, and then wearing a mask. Just if you're shedding and you don't know it, it just decreases that, something, you're going to hand something to something, you're going to get it on your hand and forget and shake hands. I mean, that's what I've had those moments where I forget that it's going on. We joke. I went into a convenience store just yesterday, and I walked in. I was like, "Oh, I don't have my mask on,"
Right.
and I just, it's nice to just forget it's going on once in a while. And I think that the key there is really having grace, and especially for yourself. And I think I've been telling parents, this whole thing of trying to parent, and you got to give it up for the 40 and 50-year-olds, because we are getting it on both ends. We're getting it with the teenagers and the young adults, and then we're getting it with our parents. And my parents have been great and gracious with all of this. But I think, I feel like with my mom, I didn't really get her attention until I said, Mom, if you get this, you're going to die in a hospital with all alone. Like, I can't be there. And that was kind of the moment that I felt like she was like, "Oh, I hear you," and
My
so,
parents were flying. I mean, a week after we started quarantining, they were still flying. My dad is doing selfies. I'm tattling on him.
yeah.
He was doing selfies because they got upgraded to first class. They had gone to DC from Birmingham. And he's like, "Look, first class." I'm like, "You're the only people on the airplane. What are you talking about?" So yes, they are. I mean, you see these memes, that generation, those boomers, they're harder to wrangle than the teenagers
Yeah.
sometimes.
Well, and I think it's like with my teenagers when we started doing cell phones.
Right.
I think we started small, and then as they showed competency and responsibility, we expanded it. You don't give a 9-year-old unlimited access to the internet on their iPhone, and I think it's the same thing as you kind of work on these interactions. And so as you see your parents, I try to in those discussions be very generous and gracious. Um, you don't want to preach to your parents. It's not very respectful. But I think really bringing it back to them in regards to look, you're in a high risk age group. If you got this, there's a reasonable chance that you could die or get very sick, and I don't want to see that happen. I want 10, 15, 20 more years with you. And I think bringing it back to uh, that kind of tone as we go forward, and give them time to work through it. Hopefully, this far along,
Yes.
they're kind of getting it.
My
And I think,
parents are good now, right? But
yeah,
yeah.
yeah, and
Well,
then I
but
think,
back to are you going to get to that, to the folding them into our social circle? Because I think a lot of people are ready, right? Some people haven't really even seen their parents
right.
or the grandparents in the past 3 months. So,
Yeah, and I think if they're doing all the right stuff, and I think that's kind of where we've tried to do is say, like, what do we need? Like, what helps us, and what do they need? And let's figure out ways to do this. In fact, my dad told me a great story at his church. That probably the guy who was the biggest. We got to get back and see each other. He just took a moment with him and talked through, like, what do you need, like what are you missing right now, and let's figure out a way to do this that's good for you. And I was really proud of him in that. But I think as you see your parents making good decisions, and if they've not been sick for the last 2 weeks,
mhm.
start small. And so a lot of people I think have been doing kind of spaced out stuff in the driveway, and going over and sitting on the back porch. But if they're making all the right decisions, and I try to do all this ahead of time. You don't want to come back and change the rules on people. But if they're just going to the grocery store and they're practicing good hygiene and they're wearing their masks, and they're not hanging out at McDonald's with 10 of their buddies talking about whatever. It's reasonable to bring them into kind of normal interactions as we go forward. I think for us it's hard because I'm around people all day long, and so that's it. It makes it difficult for us to engage because I'm a higher risk person and I don't want to put them in jeopardy. Them coming to your house is going to be safer for you. And so if someone is shedding, it's your house. Them coming and visiting you with a mask on is going to be less risky. But if they're doing the right stuff, and you kind of contract, like, we want to be more intimate, and so this is going to be what we're doing, it's reasonable to move forward and have kind of closer contact, give them a hug, and those kinds of things. And then if it's not working, if you say, like, okay, this is I don't feel comfortable with the risks you're taking, then backing off. And then I think being reasonable with yourself. I had a mom that I just love her personality. She said we had to take a Corona vacation. Like, we
Mhm.
called some family members and we met at the beach, and you know we didn't go out to restaurants, but we were definitely hugging and loving on each other. And I went back. We came home and we kind of went back to what we were doing, but I needed to be close to my friends and sit next to them on the couch. And so I think those things, it's all a risk evaluation, but you got to do what you need to do.
Yeah. I told you my sister and her husband came with their 3 kids from Atlanta last weekend to visit, and we had seen them once before. And at first, her 10-year-old said, "Can I hug you, Aunt Allie?" And I go, "No, no, let's not hug." Right. And by the end, I gave him a big hug, and he looked at me, and my sister goes, "Well, that's a mixed message if I've ever seen one." Right.
Grace,
And I said, "Well, at
Grace,
this point,
Grace.
we've been together." Right. I said, "We've been together for 2 days." Right. At first, I had to ease into it, but at the
Yes.
end of the day, right, I'm like, okay, like, do I? It's the risk versus reward, right? Like that whole continuum that is ever changing and it's so hard to navigate. And we say it's hard enough being a parent without having to worry about all of these other things to negotiate. You mentioned restaurants, right? So in our life, right, like I do the shopping and the cooking, and to minimize exposure to the outside world, we order in food, that we pick up a week, but it's very minimal. We haven't gone to restaurants yet. Is there, and I know you're going to say it's all about, right, minimizing risk. Is there a sense that if I go to a restaurant and I'm eating outside, right, is that safer than eating inside, or is that sort of is there an illusion of that being safer? And the other side is, I had a friend who was driving cross country, ended up in New Orleans, right? And their family had not eaten out at all. And she writes on Facebook that they ate at the restaurant and then quickly said, by the way, we're the only, and I mean only people in the whole establishment.
Yeah.
So we feel like we could do it, right? Like, are there like exceptions to this rule that if you say, of course, like use common sense to dictate that the higher the risk is going out, but the lowest risk on that scale is isolation within the context of that? Or are we kidding ourselves and just trying to make ourselves feel better because we want that connection of the old world again?
Yeah, I think definitely outside is better, and then the kind of the closer you are to the generation of airflow. So if there's a big vent right above you, or you're sitting next to a fan, those are going to be the safest places. You want the air moving away from you, not you don't want the whole group of people getting blown right at you. And then I think I wear a mask in, if I'm going to be in a setting like that. I'm got a mask on. It gets uncomfortable, and we joke about the Southern, what we don't have Southern rules yet on how you do all this with politeness. And to that polite point, I think, like we did with our kids when they were little, we wanted to live our life, and we would try to go to restaurants, and sometimes the kids didn't play along. And it's I think the same thing with this, going and seeing, and you may have an experience like your parents had in first class where there's nobody else in the restaurant. And that's great. You may have an experience where you're like, they're not doing anything at this place, and so I'm gonna leave now. And that's hard for me. I'm not a confrontational person, but I think that's completely reasonable in this setting. That has been something that I've really seen a lot of places of business are being much more gracious in. So when we talk about like museums and Discovery Museum and the zoo, they are really like, if you don't feel comfortable and you want to get a ticket we'll give you a ticket for later on when you can kind of come back some other time. But I think being aware and not being afraid to say, like, I'm not really comfortable in this setting, and choosing times to go when there's less people there. I think I've talked to some of the restaurants owners about what's their how well are they screening the people that work there. And so those are the big things that you're going to want to see, is that they're asking people when they come in, as far as the employees, and then also with the people that are eating there, are they screening them and making sure that they're not sick. And then and I think what I've tried to do is, I see good stuff happening, I've really tried to share those that with other people, so that we are lifting up those businesses that are that costs them money to send people home when they're sick. It costs them money to not have as many people in their restaurant. And they're doing that for us, and I really appreciate that. And so I've really tried to be positive when I see people doing the right thing, and share that. And I think, and I'm listening for that when people tell their stories. They'll say, like, we ate there and the whole place was just jam packed. I'm like, oh, I'm scratching that place off my list.
Yeah, I think the rule today, or at least the lessons learned and every day more pronounced, is that the cost of doing business or not doing business is nothing compared to the cost of losing our humanity.
Right.
So yeah, which is important.
Well, and it's the in a highly commercial, highly materialistic society, it's all about what's new that we can buy. And I think coming back to the most important thing is each other, and enjoying that. I had a lady tell me yesterday. She was telling me the story about just her challenges with her mother, and they had there's grandkids, and they were having, grandma was getting upset couldn't see the grandkids, and they were kind of walking through that process, and they'd gotten through it, and grandma had kind of gotten the clue and was doing the right things, and the grandkids went to visit grandma, and she was like, it was the best visit we've ever had, because the kids had a new value for that time with their grandmother. And so I think just to realize that we are coming back. you can make it all about yourself and find everything that's an inconvenience right now and just live in that, or you can come back and really value the fact that, for me, I have three amazing kids that have been unbelievably gracious as I've fumbled through this as a parent. I have a wife that has taken unbelievable care of me, and loving on me when I come in tired and frustrated and just sit there and stare off at, into space. And then I have parents that reach out and have been very patient, um, you know, staying connected over space and not being able to be physically together, over, holidays, and we've missed birthdays during all this, and we've missed sporting events. And so, I think really coming back to focusing on the people in our community and that we need them, and how is all this experience showing us, what we need as people, and then being open to letting that expand, to the people that we wouldn't normally think about, that are not normally in our sphere, that either, are different from us religiously, or different from us in how they look, or they go to different high schools, or they, have different types of careers, and making sure that we're thinking about how they're doing and enjoying who they are in the midst of this, and listening to them, and looking at things, that how we structure this. We don't have to go back to all the normal stuff.
Right.
And so when we see stuff that was normal, that was not good, we let's not lose this opportunity to make our communities a better place.
Well, on that note, right, just a wonderful reminder of the sacredness and significance of grace and gratitude, not only for ourselves, but each other. I might be quoting Lester Holt at this point because I listen to NBC every night, right? Take care of yourselves and each other. And also, I just want to note, and I think you brought this up at the beginning of our episode, but I want to reiterate that both of us have heard from so many people, parents and community members, who have just sort of personally and privately thanked us for doing this. And I want to tell you, and we hear you and we see you, and we want to remind you, if it should not go without saying, that you are not alone, right? Like,
Right.
even in this continued semi-isolation and quarantining, we will find connectivity, we will make community, and we will make sure that no one, no matter your circumstance, where you live, what you need, you have neighbors and people who love you and care about you. So thank you to those of you who are watching and offered your wonderful questions for Dr. Coffman. And Dr. Coffman, as always, thank you for taking my call.
Thank you, Alison. It's always good to talk to you, and look forward to Sunday.
It is cathartic for me, I promise you. Best medicine out there.
That's right.
Thanks, Doc.
All right, we'll see you.